previous video, I had discussed about stabilization technique in general management of poisoning. That we had came across with A, B, C, D technique. A represent airways, B represent breathing, C represent cardiac failure, and D represent depression of central nervous system. Let us see about depression of central nervous system. So what is this depression of central nervous system? So many times during poisoning, the patient may come across with central nervous system depression. Unarousable lack of awareness with a rating of less than 8 on Glasgow coma scale. So this condition is called as depression. This Glasgow coma scale, so it is widely employed to assess the coma, especially observed during trauma condition. This European Association of Poison Centers and Clinical Toxicologists, EAPCCT, says that this Glasgow coma scale is inappropriate for acute poison condition. But even with the help of this, the coma can be assessed in severe trauma center. I will be talking about this Glasgow coma scale by taking the parameters, how we are going to assess it and how the coma will be calculated. We have other scale also, like reaction level scale, compressive level of conscious scale called the CLO, CS, and we have coma recovery scale, Hinsberg scale. Let us see about Glasgow coma scale. This scale comprises 3 tests, which includes observation of eye, verbal and motor responses of a person. These 3 parameters will be assessed and various ratings will be provided. The lowest possible GCS number what you are going to get score, that is the 3. In that we can conclude the person is in deep coma or death. While the highest is 15 score, it represents fully awakened person. This score will be obtained by summation of 3 tests or responses what you got from eye, verbal and motor. Let us see about the scale. This is about the Glasgow coma scale. Here observation we can observe, feature observation, where we came across with 3 observation of eye, motor as well as the verbal responses. Here we can observe scores. Let us start with the eye opening. Individual scores will be taken up to 3 and it will be get summated at the end. Now in the eye opening, if it is spontaneous, and the score will be given 4. And if eye opening is observed because of speech, then score can be given as 3. And eye opening observed because of pain, so then 2. And if eye observed is not observed by applying any of this, so then the score will be given 1. It's considered nil. Fine. So then coming with the best motor response, suppose if a person obeys for the responses, then M3, M6 will be given, motor represent M and 6 score will be given. Here the patient will be doing a simple task what will be informed to him. Then score 4 will be given for localized, like purposeful movement to the pain can be observed in this condition. And number 3 will be given for flexes, where withdrawal can be observed, especially flexion of the elbow. These are the responses will be induced when pain have been given to the patient. Then number 2 will be given to the extent, decerbate rigidity can be observed, less movement. Number 2 will be given score, and nil will be declared suppose no motor response is observed and 1 score will be given. Then coming with the next is the best verbal responses. Upon verbal communication, if the patient is well oriented, and V5 will be given. 5 is the highest score in verbal response. If the person found confusion, so then it will be given 4. Suppose he is using inappropriate words during conversation, so then 3 will be given 4. Incomprehensible sounds it is producing, unable to speak out with the words, so then 2 score will be given, and no response means nil, it will be given 1. So now with this we will be observing the patient, and the scores will be given in 3 categories: eye, motor responses and verbal response. Then at the end we will be summating it, and if the score, if it is reaching near to the 15, so then the person is fully awakened. If it is coming with the lowest range 3, so then the person may be in deep coma or he may be dead. Let us try to see an example how to interpret Glasgow coma scale. Now here an example representing ECS 9 is equal to E2, V4, M3 at 7:35. So as I told, like a summation of the 3 responses will be taking here. One is the eye, vocal as well as motor responses. So now here GCS9 it's because of E2. Here with I 2 score have been taken, and the V the response was 4, and with the M the response was 3. Summation of this 4 plus 3 plus 2 should be getting 9. Then how to interpret it? Generally the brain injury can be classified severe if GCS is equivalent or less than 8. If it is moderate, then GCS score will be 9 to 12, this is the range, and minor GCS if it is more than or equivalent to 13. 3 ranges we have. Severe means 8, moderate means 9 to 12, and minor means 13. So with this example we came across with 9 to come in the moderate section. This is how we are going to interpret. So now in order to overcome with the drawbacks what I told with the earlier scale, because they are very much suitable during trauma condition or head injury rather than some acute poisoning condition, some predictive value may remain uncertain, because the reasons here it may be because of some drugs. Some practical guidance what we will be using under grading scale may be very much easier and reliable in such condition, because this grading scale also has some additional advantages, that it take account not only your CNS depressant which will be produced by CNS depressant agent, but also some CNS stimulating agent which can produce coma only in the last stage. So here both the category we can observe, some depressants which can cause toxication and stimulants. Here scoring can be given. Here the grading score, so it will be from 0 to 4. 0 represents asleep but can arouse. Grade 1 will be given for semi-comatose, withdraws from painful stimulus, reflexes intact. 2 grade will be given for comatose, does not withdraw from painful stimulus and reflex intact. So here some pain will be induced as a stimulus in order to show some response. Then number 3, comatose, most reflexes got lost and no depression of cardiovascular or respiration. Grade 4 will be given for comatose, reflexes absent, respiratory and circulatory failure can be given. So here almost the person is not responding for any type of stimulus. Then coming with the CNS stimulating agent, grade 1 will be given, which is having restlessness, irritability, insomnia, tremor, hyperreflexia, sweating and mydriasis. 2 for confusion, hypertension, tachypnea, tachycardia, extrasystole. 3 for delirium, mania, arrhythmia, hyperpyrexia. Grade 4 for convulsion, coma and circulatory collapse. Because stimulation agents will start early with the stimulation and end with the depression. This is the grading can be given, which will help in predicting the coma condition in a person. Now let us see some causes for coma. As we know, like some trauma may lead to coma. Other options like up to some poisoning condition also may lead to coma. But in some cases, it will become difficult to distinguish psychogenic coma or hysterical coma from the real coma, which may happen because of poisoning or because of trauma. Let us try to understand what is this psychogenic coma or hysterical coma. So many people, so they want to get attention from the people. So they may show some suicidal gesture, but they don't want to end their life. Just their intention is to grab an attention from the people. They never want to end their life. In such condition, the person may act like he became coma. In such condition, it will become difficult for an physician to identify whether the patient is active or coma, whether the treatment will become difficult for him. Let us try to understand about the mentality of the hysteric coma people. Like suicidal gesture, if a person is having a suicidal gesture, so he will be having so many points what I have enlisted here, like telltale fluttering eyelids will be observed. By observing this, we can confirm like the patient is not under real coma, is active. The patient who is half walked, half dragged by his relatives, an elaborated suicidal note might be written by him before committing suicide. So he might have called his friend or relatives and he had explained about the next step what he is taking, so that he don't want to end the life but he want to get attention of the people. Sometimes like pill bottles driven about, which can give a clear idea, because many people if they want to end the life, so they may not be leaving any things. In addition, signs and symptoms which will manifest by the patient usually are out of the portion to the ingested itself. Many times the people, so they will act and they will show some symptoms. That symptoms may not be related with the symptom which poison he got ingested of. So in such condition, by observing the suicidal gesture, also will get an idea whether the person is in hysterical coma or in a real coma. So now how humanly we can determine the coma, whether it is true or fake. By observation we had a doubt, so now it should be get confirmed. Some of the older technique which was used, nowadays it is considered as barbaric acts and it's not employed, it should not be employed, but let us enlist it and which method is used now, that can be checked. In olden technique like pinching of nipples or genitals were done because of some shyness or humiliation, we used to respond so that fake coma can be revealed. Or repeatedly pinching any part of the body can also serve the purpose. Or slapping the face very hardly and repeatedly can also help. or sometimes cotton threads or sterile applicator tips soaked in ammonia solution might also be inserted in the nostril in order to get some reflex responses. That technique should not be used, but now following steps are recommended. Quick physical examination should be done, with particular attention should be done about the breathing, vital signs and gag reflexes. If these reflexes are normal, then coma, it is the psychogenic. We can confirm it. So then even other indication can also be observed, like tightly clenched jaws can be observed when voluntarily, if you want to open the jaws, the mouth will be tightly held. So this may be one of the reason. However, first we should reveal about the episodes of seizures. If it is not, then it can be considered. So then one more technique what can be followed, that is the useful technique. You have to lift the patient hand directly above his face and you have to let it to drop down. In psychogenic condition, the hand won't fall on the face, instead it will fall aside. Actually, when you are letting the hand down, it should obey the law of gravity and it should fall on the face. If it is not falling on the face, if it is face falling aside, so then clearly it is an indication of fake coma. So then other technique, even it is repeated pinching of the shoulder can be done. Only not more than twice it should be tried. Even some clinician advocate rubbing the patient's sternum with the knuckles so that a pain can be induced and coma may be revealed. Fake coma can be revealed. Let us see some key successful tips to manage this psychogenic loss of consciousness. This thing should be in the mind of a caretaker while ruling out the fake coma, so that the person who is acting should not get affected with the self-respect or dignity of the person. Avoid humiliating the patient in front of either relatives, friends or hospital staff. This is the first thing should be done after understanding the fake coma. Then next, making it know loudly to the patient that friends and relatives are waiting outside and that the poison should be wearing off about now. Like we should convince the patient, telling that even though we know like a patient is acting, but in order to maintain his dignity, this sentence should be used. Then we should keep on explaining what has to be done and why in a non-emotional tone. Then we should avoid physical abuse or humiliation. It will often enable the patient to regain consciousness over a period of few minutes with high dignity and self-respect intact. These are the key success points should be followed by healthcare professional. If the patient still is not responding whatever the technique we are using, so that we can ingest some of the harmless substances to him, so that he may get recovered after consuming this. Then in order to maintain his dignity, after administration of some substances, he may get conscious. Or sometime what you can do in the sense, it's better to leave the patient alone for some time. But however, suppose still if you have doubt in such condition, we can go with a gastric lavage technique, so that anything got ingested, if it is unobserved, or we can prevent further absorption also. So in the next class, I will be talking about the management aspects involved in ABCD technique. Thank you.